Hi everyone, today I'm going to show you how to prepare for your dog's upcoming surgery, and then I'm going to show you my dog's first 2-week recovery from CCL and patellar luxation surgeries, so you can have an idea what to expect. So I took Sissy in for her surgery on Tuesday. The night before that, I packed and labeled all her stops. I packed her this specific soft cone since I have bought and tried many different ones before her surgery to get her used to it. This was the only one that she tolerated. If you still have a bit of time before your dog's surgery, I highly recommend you to start trying out different cones, see which one they like best, and also get your dog used to wearing it so it doesn't add unnecessary stress for them after the surgery. I also packed her nail clipper because she's going to be under anesthesia anyway, so I asked them to help clip her nails as short as possible, as I know I wouldn't be able to do it for a while, and I don't want her nails to be longer than it should be, since long nails also increase the risk of sliding and slipping, which is not ideal after a knee surgery. I brought my dog in around 8 in the morning. Once I dropped her off and came back home, I started setting up her little area that she's gonna stay in the next 2 months. I used this freestanding foldable gate to block her access to the rest of the apartment. I have a small and rather low energy dog, and it works for my purpose. Actually, at the point of editing this video, I don't recommend this setup anymore. Sissy was able to knock her gate off to prison break. Thankfully, she wasn't hurt, and it's been almost a month since her surgery, so there wasn't any damage to her, but it could have been catastrophic if it happened earlier. So now I think the setup is actually safer. I also deep cleaned her area, and then I set up her potty pad as well as water in front of her crate to make sure that she can access those easily, and wash all of her beddings to make sure everything is nice and clean before she comes back. I highly recommend getting a bunch of these baby sheets before the surgery. It's one of the most life-changing hacks that I've discovered for my dogs. With a few of these sheets on hand, you can easily remove them to wash and change to a new one. I will mention why it's important for their recovery progress later on in the video. Oh, by the way, I highly recommend this soft-sided dog crate, as dogs instinctively want to hide in a corner when they are in pain. So the first night or two, they will probably want to hide inside the closet or under the sofa, under the bed, and this is just a perfect choice, and it will make them feel more safe and comfortable after a surgery. You can also close the zipper to limit their access whenever you have to quickly go somewhere and can't supervise them directly. Just be sure to get something big enough for them to lay down and turn around comfortably. Sissy had to stay at the hospital overnight, so today started bright and clear with a call from the surgeon updating me on Sissy's status. Good news, she's doing well. They said I could pick her up anytime after 10 a.m, but I had to take Boo to his dental checkup following his full mouth dental extraction 2 weeks ago. So as soon as I wrapped up Boo's appointment, I headed over to pick up Sissy at 11 a.m. Let's call this day 1 of her recovery, since her surgery wrapped up pretty late, around 5 p.m. yesterday. I prepared this carrier, which already has a very supportive bottom, but I also put another hard layer underneath to make it as supportive and stable as possible. The vet tech finally came out with Sissy. I was a bit nervous looking at the way she put her down with only one hand, but anyway, I was grateful that she made it safe and sound with the surgery, and that she came back with us now. I was so happy to see her again. The house felt so empty without her yesterday. We got an Uber, and she was finally smiling to me as her way of saying, "I'm so glad to see you again, Mom." It was really hard to get her out of the carrier, as the effect of anesthesia hasn't fully worn off yet, and all her limbs are very weak and clumsy right now, but thankfully she's tiny at only 7 pounds, so after struggling to find the perfect position to lift her up and make sure she's most comfortable, I managed to get her inside her little crib. I also started icing her like they have instructed as soon as I took her home. This is the list of medications that she came home with. All of them are pain meds actually. So don't worry if your vet sends home a bunch of different pain meds. The vet often uses a combination of different pain meds so that number 1, they could target different aspects of pain simultaneously, and number 2, they do so in order to reduce the dose of each medication to a safer level to reduce the risk of some potential side effects often associated with higher dose of each of the medication. For example, meloxicam, which is an NSAID, can have some serious side effects at a higher dose, such as gastrointestinal upset or ulcers, renal or liver toxicity. That being said, these medications are generally very safe when appropriate dose is given. So please Please do not withdraw the pain med from your dog just because you are afraid of the side effects. The comfort and quality of life are just as important. So please try your best to stay on top of their pain med so that they can feel more comfortable when recovering from a surgery. I attempted to offer her some food so I could give her the medications, but she refused to eat. It's crucial to note here that certain medications such as meloxicam and antibiotics should either be mixed with food or given after a meal to prevent stomach upset. I called my vet to ask, and he advised skipping the meloxicam if she wasn't eating. Buprenorphine and gabapentin, on the other hand, do not necessarily require your pet to eat beforehand, and you can administer them by lifting one side of their lip and carefully sliding the syringe into their mouth. Until the effects of the anesthesia fully wear off, it's expected for them to feel extra groggy and drowsy and not wanting to eat anything, and some of them can also experience some side effects from the anesthesia during the first 24 hours, such as vomiting, whining or crying and shaking. Some people freak out when they see their dog acting like that and think that the dog is in extreme pain since they are being vocal and restless. But I want to reassure you that these are all normal side effects of the anesthesia. Unlike human, dogs aren't exactly vocal when they're in pain, and if anything, dogs can be unusually quiet since they are trying to hide the pain. So if your dog was whining after the surgery, more often than not, it's because they are still confused and disoriented after the anesthesia and not sure what is going on, not because they were trying to express their pain. Of course, they're going to feel some level of pain after a surgery, but your vet should have given them sufficient pain med before sending them home to keep them comfortable, so don't worry too much about that. If you are still worried, just pick up your phone and give your vet a call and ask any questions you might have. I know it's stressful seeing your dog like that, but just be patient. They will get better. Around 6 p.m., which was about 25 hours after her surgery, I boiled some chicken and shredded it into small pieces. And thankfully, she started regaining her appetite and she started eating without any issue, so I could finally give her the meloxicam. I was hand-feeding her piece by piece so she didn't have to stand up to eat since she didn't have any strength to stand up anyways. Unlike other surgeries that she had before, this time she started having accidents on her bed. I think she was too tired and her leg just felt too weird, so she didn't know how to get up and just wetted her bed. I totally did not see this coming, and once she was already inside her crate, it wasn't exactly easy to get her out when she was feeling really groggy. So this is something I definitely regretted not preparing beforehand. Once I feel like she started to feel better, I used my hand to support her belly and help her get out of her crate to clean up her accidents. I put a pee pad on top of her bed before covering it with a baby sheet. This setup worked perfectly, and every time she had an accident, I only had to change the pad and the sheet and she will have her bed back almost immediately. And this is why earlier on in the video, I highly recommended you to buy a few of this and watch them well before the surgery. And don't worry, this doesn't last long. They will most likely just have accidents during the first day or so and will eventually go potty on their own once they gain enough strength and consciousness back to do so. So that's the end of day 1. We made it through it. I woke up at 4 in the morning to give her one of her pain medications. The first few days are usually the hardest for your dog, so you want to stay ahead of the pain and give them the medication when it's due. By the way, I highly recommend having some sort of system to keep track of all of their daily meds. This is really good to have to avoid making mistakes, given that they will most likely be on several medications a few times a day. I also tried to use this thing to provide her some support when walking around, but because she was too small, this was really awkward and didn't really work for her. However, I can imagine how helpful this could be for bigger dogs. She finally regained enough strength to pee on the potty pad by herself about 36 hours after her surgery. So yay! She was still very weak and could only take 1 to 2 steps before sitting down again, but she was definitely a lot stronger on day 2 compared to day 1 when she couldn't stand up by herself at all. However, she seemed to be really uncomfortable and itchy today. She has this problem every now and then, and I've paid multiple visits to the vet, and I even paid for the urine analysis to rule out the cause of the itchiness, and they didn't provide any solution after running the test, and now is really the worst time for her itchiness to come back. I was so worried since she was so restless and constantly moving around to try to reach her vulva. So I gave the surgeon a call to see what I can do to temporarily relieve her itchiness so that she could rest. He told me to get some Benadryl and give her a quarter of the pill twice a day. I tried that, but unfortunately, it didn't work. She would constantly try to reach her vulva for 1 to 2 hours and then rest for maybe 15 to 30 minutes at most, and then come right back back at it. That was how uncomfortable and itchy she was. She didn't let me ice her on day 2 anymore now that she was fully conscious and awake, so I didn't really force her to do it as I wanted to prioritize her rest. Icing is incredibly effective to bring down the inflammation, which will also help with the pain. So if your vet recommends the ice therapy and your dog tolerates it, that's the best case scenario, and it will help speed up the healing process. However, if your dog doesn't tolerate it, don't stress out too much. It's not the end of the world, and meloxicam will also help to bring the inflammation down as well. Towards the end of day 2, I don't know why, maybe she was calmer after taking the gabapentin, but I managed to trick her into this position where she was literally just icing herself by holding her front leg next to her knee, and she just kept it there for the whole time without fighting it, so that worked out perfectly. Also, she came out her litter crate and slept on her bed towards the end of day 2, so that was also a sign that she was feeling a lot better. Her itchiness hasn't gotten better yet, so she was pretty much restless for the entire night. I couldn't sleep at all and was constantly checking on her and trying to stop her from scratching and moving around too much. Honestly, it felt like a nightmare. I found myself in a pretty dark headspace with all these negative thoughts swirling around. Things like, I didn't deserve to have a dog, or can she make it through this? I think her surgery might fail if she keeps doing this. It was really stressful. I couldn't bear seeing my dog in so much discomfort anymore, so I gave her regular vet a call early in the morning to see if they can prescribe anything to make her itchiness go away, at least for now, so she can focus on resting. To my surprise, after waiting for the solution for 6 hours, they called me in the afternoon and asked me to bring her in, despite my efforts to explain that she just had her surgery 2 days ago, and it's not safe for her to come in. After that, they told me to bring her urine sample to the office so that they could run a test. I was frustrated and I couldn't take it anymore. I paid for urine analysis just 3 weeks ago. The test has already been done and they did nothing about it. She still had the same symptoms as the last time I took her there. Nothing has changed, and given the urgency of the matter and how I spent thousands of dollars at their place over the years, I don't think it's unreasonable for me to expect them to do something about it. Something that they should have done 3 weeks ago. Anyway, I was so mad at that point, but I had no time to feel angry. I had to focus on finding a solution. In a stroke of luck, I stumbled upon this website with online vet consultations. I booked a video call session and the vet was literally able to see me within 1 hour. And let me tell you, it was a game changer. She was super understanding, attentive, and diagnosed Cece's issue right away. She prescribed a course of antibiotics as well as some topical treatments for instant relief. It was such a great experience, and I was so thankful for her. I'm gonna put the link to the website down below. I believe that all pet owners should have this website handy because your vet isn't always gonna be around to answer your questions. And sometimes, our anxiety can be off the roof the moment we see something wrong with our dog, so it might be worth it to have a licensed vet to answer your questions. You can use my referral link for 40% discount off your first appointment. Anyway, so I followed her instructions, gave Cece the antibiotics with her dinner, and applied the topical treatments. And Cece was responding extremely well to it, and by the end of day 3, well, she was still itchy of course, but she was a lot less restless. I was also able to ice her later that night, so that was awesome. Things are looking a lot better today. She slept through most of the night. She only woke up once or twice during the night, trying to scratch for about 5 minutes, and then quickly went back to sleep. And she pretty much stayed like that for the rest of the day and was mostly sleeping with the occasional getting up and scratching her vulva for about 5 minutes before going back to sleep again. I was so relieved to see her getting better and more comfortable and was finally able to rest and give her incision site a chance to heal properly. She also got a lot stronger and became more comfortable moving around as well. She was still limping and didn't really use that leg yet, but any progress is good progress. She finally put back her happy smile today. This gave me hope that there's light at the end of the tunnel after all. Her itchiness was almost gone by day 5. She could still only take a few steps before sitting down again, but she's actually starting to put a little bit of weight on her right leg, which actually surprised me, since the surgeon told me it's gonna take her about 3 weeks before she starts putting weight on that leg again, given that she had both the CCL and patellar luxation surgeries at the same time, so it's gonna take take longer for her to recover. I could tell she was getting a bit bored by day 5. She was finding ways to burn off her excess energy. By constantly digging her bed, I carefully monitored to make sure she didn't hurt her leg in the process, but she seemed fine, so I just let her be. She hasn't pooped by day 5 though, and I started getting a bit worried. I already knew from experience that it's gonna take them a couple of days before they start pooping again because the anesthesia and the pain meds could cause constipation, but 5 days without poop is a bit longer than I would have liked, so I started adding pumpkin to her meal to help her a little bit. She was really back to her normal happy self by day 5, as you can see. She even slept with her belly up comfortably. She could have stopped doing that ever since she tore her CCL, and seeing her doing it again just made my heart so happy. Her itchiness was gone by day 6. She was eating well, sleeping well. She also let me apply some heat therapy on her for a brief moment before she started protesting again. She was doing so well that she even decided to go on a little prison break adventure. I was in the living room doing something and I was so shocked to see her slowly walking over to me. She's so naughty and sneaky that the freestanding gate system didn't even last for 6 days. I was so speechless. I had to tighten my security system after that incident, and I had to lock her inside her little crate every time I have to go to the living room or kitchen and can't supervise her directly. Her incision site was looking a lot better, less red, less inflamed, so that's a good sign. She still hasn't pooped today though, despite my effort to add pumpkin to her meal, and I was getting quite worried. Day 7, I decided to add even more pumpkin and some water to her food in the morning, and I even added a little bit of laxatives, but she didn't poop at all. She was doing well otherwise. She seemed happy, comfortable. She was eating normally, drinking and peeing normally, but seeing that she hasn't pooped for almost 7 days, I really freaked out. Despite my elevated stress level, Cece didn't seem to bother one bit by her lack of poop and was just being her normal, happy, goofy self. I decided to widen her little area a little bit so she could have access to the bathroom to see if maybe she felt more comfortable pooping inside the bathroom, but she just went in to pee and then left. In the afternoon, I couldn't take it anymore, so I decided to email the surgeon to ask, and he was super responsive and gave me a call back quickly after receiving my email and tell me not to worry if she's eating and drinking normally. Eventually she will go, so I felt a little bit better. Later in the afternoon at around 6 p.m, she finally decided to poop, and I swear I've never been happier to see her poop in my life. It felt like a huge weight off my shoulder. I decided to celebrate this milestone by letting her on the sofa. I only did this because my Pomeranian never jumps on or off the sofa by herself, and the only way she would ever get on or off the sofa is by me picking her up or bringing her down. If your dog has a tendency to jump on the sofa, I would not allow them on the sofa or bed until the surgeon says it's safe for them to jump again, which is probably going to be a few months down the road. So before we move on to the second week of her recovery progress, I just want to take a quick moment to let you know that we have added a bunch of new items to our store, from personalized pet embroidered sweatshirts, hoodies and t-shirts that resemble the dog with unparalleled precision and details, to custom pet pillow. We've been through a really tough time and the medical expenses in New York City is no joke. So your support during this time would mean a lot to us. Day 8, she's recovering really nicely. She's been eating well, resting well, and she was able to get around by her own pretty much comfortably, and she's been doing her little stretch routine as well. Her incision site is also looking much better. Oh, I forgot to mention, but I also been giving her half of this Dazoquin Chew daily. This is something that the surgeon recommended, and it's basically a joint supplement to help her with the recovery. This contains glucosamine and chondroitin sulfate, which are key components of cartilage, so they're commonly used to support joint health and help repair damaged cartilage and maintain joint function. Day 9, since she was healing really nicely, I decided to give her a little break from the cone when I was sitting on my desk right next to her so she could play with her favorite ball. It was a wrong move, let me tell you. She took advantage and decided to go at her stitches when I was too focused on working. Thankfully, her incision site has mostly been healed. It looked a bit more inflamed, but nothing too alarming since I caught her not too long after. So here's a reminder for all of you not to let your guard down at any moment until your vet removes the sutures and clears your dog from the collar. Sure, it's uncomfortable to wear this cone, but it's going to prevent your dog from a lot of unfortunate incidents. Just keep them on at all times. It's better to be safe than sorry. Anyway, other than that small hiccup, she's been doing really well on day 9. She had a little digging session and then chilling on the sofa and watching movie with us at the end of the day. Also, I've been using this little playpen for her in the living room, so she could feel more included whenever we are in the living room cooking or eating dinner, and also avoid the possibility of prison break again. Day 10, everything looked really good. She's been sleeping well, and her incision site looks beautiful, and the redness is completely gone. She's still only putting a tiny bit of weight on that leg, but that's to be expected with her lateral suture surgery. Day 11, the incision site looks perfectly healed. She's scheduled for her suture removal on day 13, so that's coming soon. She's also walking around and using that leg pretty nicely. Day 12. Well, I think the hardest part is when your dog starts feeling better. They started going back to their normal reckless self. I made a mistake of leaving the toy with her and then went to the kitchen quickly. And she was doing this in her small contained area. So be sure to only let your dog play with their toys under your supervision. She also got a bit too bored of the limited space that she has and started throwing a little tantrum by destroying her potty pad. Seriously, I don't know what to say. I'm convinced she's a monster. She just happens to be a cute monster. Day 13, she went back to the hospital for her suture removal. The surgeon said everything looked good, she was healing nicely and put nice weight on her surgical leg. So that's some good news. She went back home and was showered with treats and love from the doorman. She could finally take her cone off and enjoy her freedom. This is how her incision site looks after the suture removal. She behaved for pretty much the rest of the day. She had some occasional bursts of energy that worried me a little bit, but I think it should be fine. After all, there's only so much that we could do for them. Dogs are dogs at the end of the day, and you can't really tell them to lie down in one spot and do nothing for 2 months straight. She seems very comfortable getting around by her own, and she doesn't seem to be in a lot of pain, probably because of all the pain meds as well. Day 14, she still has to stay inside the small part of the bedroom to make sure the bone is healing nicely. But other than that, her life has been pretty much back to normal. Her leg is not fully back to normal yet, and there are days that it seems worse than others, and I think today is one of those days. If your dog gets a little bit worse after they got better, don't worry too much. Remember that progress is not linear, and although it might not look good to you compared to maybe yesterday, if you compare that to say a few days ago or a week before, you would be surprised how far they have come. So just stay positive and hopeful everything will be okay in the end. So that's the end of her 2-week recovery journey. I think the main takeaway lesson from this is to take care of your physical and mental health as much as possible during this period. I know it's easier said than done, especially when your brain is not functioning properly with the lack of sleep. It's probably gonna feel like hell in the first few days, I'm not gonna lie. You're probably gonna have some mental breakdowns, some moments of self-doubt and despair like I did, but I just want to let you know that there's always hope and everything will be okay in the end. Just trust the process, and your dog will get better day by day. First week is probably gonna be the toughest. They're probably gonna be in pain, they're gonna be uncomfortable, they're probably gonna whine a little bit, throw a little bit of tantrum, but they will eventually be back to their normal, happy self as days pass by. I truly think that their surgeries are often harder on us humans than they are on them, because it's mentally torture for us to see them suffer. So please remember to take care of yourself as well. If you found our video helpful, please don't forget to click on the like and subscribe button to show us some support, and also get some items from our store if you can to support us during this difficult time. We sell this cute and unique personalized pet embroidered sweatshirts, hoodies and t-shirts so that you can always feel like your little friend is right here with you in your heart, literally and figuratively. Thank you so much for watching our video, and I will see you in the 2-month update video.